Friend, I am Dr. Mohammad Chaudhary, MSCOO7 version. Welcome to science class. As a student of science, I wanted to take flavor every branch of science. What kind of things say do that is but that is knowledge, that is yes, and that is good, what that is then. Acute patients. In case of my patient, I salute my twinkle twinkle soil star. Ya Alif Lam Lam Ha. Ya Allah Shafi, Allah Mafi, Allah Kafi. Abdul Shafi, Abdul Shafi, Abdul Mafi, Abdul Kafi. Dead patient situation. In case of dead patient, by the name of constant multiple case science one and only creator, Ya Allahu. Ya Alif Lam Lam Ha. Ya Allah Shafi, Allah Mafi, Allah Kafi. Abdul Shafi, Abdul Mafi, Abdul Kafi. Alive again by the help of constant multiple case science one and only creator, Ya Allah. Now my pen supporter, correct or not, after correct royalty, disease and death. If dead patient alive, then royalty, otherwise. Now my friend supporter all over the world, science class. As a student of science, I wanted to take flavor every branch of science. What kind of things they do, that is what, that is knowledge, that is real, and that is good work, that is an art. What I do, how dead patient can alive. By the help of constant multiple case science one and only creator. As a one and only creator name or nomenclature, I say Allah. All good name for one and only creator, Allah. All nomenclature, all good nomenclature for one and only creator. As a Muslim, I say Allah. And that is also creator which way. Ya muhi Allah. Allah can give life. Ya mumin to Allah. Allah can take life. But in case of as a creation, what I do, one and only creator give me right. That is the reason I, in case of dead patient, life is disconnect from body. That is the reason not body is not work. By the help of constant multiple graceful, scienceful one and only creator, Allah, I, in dead patient, I, if life present, death angel not take away the life present in body. Just connect the life with body. Then start. Okay, fine. Then body function start. And what is the reason, cause of death? Correct that. Then patient alive. Just like magic. That is not magic. That is medical science. Creation science. And creation science branch medical science. As a Dr. Sohel, you know that. MSCOO7 version Dr. Sohel. One and only creator give me my creation element criteria. For example, soil life, soil cell, soil cellular components, soil DNA, soil codon, soil best criteria. That is the reason I can do that. By the permission of constant multiple graceful scienceful one and only creator. Otherwise not. Those are see, they are believe, those are not see, not I have no headache. If alive, then should have royalty. If this is correct, then royalty. Otherwise, no. Okay, fine. Not quarrel about that, not debate about that. Try to understand. Now, my friend and supporter, we now you know that policy. Those are my patient. You know that. First, if you suffer the disease, you say creator name. What name you say creator? Like God, Ishwar, Bhagavan, Khuda, Mabud, Ilah, Allah. As a Muslim, I say Allah. By the name of constant multiple case science one and only creator. As a Muslim, I say Allah. Say that. Then what disease occur, you try to understand that. How? Your pulse, adult pulse, equal above 100 or below 60 or not. Your breathing above 25 or 24. For example, your breathing rate 16 to 18 normal, above 24 or not. Your pulse rate above normal 70 beat per minute, above 100 or below 60 or not. Then your BP, blood pressure, the diastolic pressure, low pressure, lower pressure, below pressure, normal pressure 82, 120, normal adult patient. Your below pressure above 90 and below pressure above 90, diastolic pressure, and systolic pressure above 139 or not. See that? Then your bowel movement or per day stool, the per day of uh, stool, how much time you go to the toilet per day, more than 3 times or not, and urine, how much time you go to the urination normally, you know that per day the intake and output urine, how much water you intake, how much output the urine, you calculate that, you try to understand that. And painful urination, urine color, stool color remain normal or not, or feel pain or not. In case of pain, feel pain any part of the body, any part of the body, if you feel pain, that is the sign of inflammation, sign of trauma, sign of injury. And sign of inflammation, what is this? Rubor, redness, or hot area you traumatic, either injurious agent or trauma, either injurious agent or trauma or hurt by anything, and trauma mean hurt by anything in your affected area, body area. The sign of inflammation, the inflammation offered by injurious agent, infectious agent, injury occurs, cell injury occurs by injurious agent, other cell injury, you not suffer any heart or trauma, injury occur. What is the reason? That is the reason of infectious agent, injurious agent enter into body. That is the reason. In case of trauma, you hurt by anything. That is the reason trauma occur. You easily understand that. And in case of infectious agent, what is the infection agent? Virus, bacteria, parasite, helminth, fungus, then allergen particle. That is the injurious agent and virus, bacteria, parasite, helminth, infectious agent, fungus, infectious agent, and allergen particle. That is also injurious agent. In case of virus, the treatment protocol is simple. If you diagnose the bacterial infection, antibiotic, viral, antiviral, protozoal, antiprotozoal, helminth, antihelminth, fungus, antifungal, and allergen particle, antihistamine. That is the treatment protocol for my patient, and those are know that. And in case of traumatic injury, what happen is that muscle injury or bone injury or fracture occur or not. If fracture not occur, muscle injury, for example NSAID with proton pump inhibitor, treatment of protocol, or injury occur, you know that severe pain by fracture, you know that is also NSAID and proton pump inhibitor. But pain is not controlled, then pethidine, morphine iron, and in case of fracture, correct the fracture. How you correct? In case of orthopedic surgeon, You know that what to fracture occur, plaster given, and combine the fracture area and plaster given. In case of plaster, sometime malunion, non-union. First correct the union into in bone, then do plaster, then take a X-ray, soft plaster, then take a X-ray. After see the X-ray, the joint, the bone union, fracture in into in, bone in reunion perfectly, then soft plaster to hard plaster done. By that policy,